Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we'll open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I begin, I'd like to clarify an answer I gave yesterday to a question about Step 2. The question asked me when any of the restrictions eased in Step 2 would take effect. I indicated that a decision would be made on March 1st, and also referenced an earlier commitment to give businesses 1 week's notice before easing restrictions, which combined would have led to a date of March 8th. This earlier commitment was made in the context of the Step 1 changes, and in particular to provide restaurants with enough lead time to prepare and have a chance to reopen on an even footing. We know that lead times vary by sector and business. Given that each step in the path forward contains some unique elements, the same notice may not be required for businesses in Steps 2, 3, or 4. If a decision is made on March 1st to move to the next step, it is possible that restrictions could be eased the same day. This decision will depend on what we see in our leading indicators this week. Turning to today's updates, more than 180,000 doses of vaccine have now been administered across the province. More than 107,000 Albertans have received at least one dose, including 73,000 who are now fully immunized with 2 doses. Over the last 24 hours, we have identified 267 new cases of COVID-19 and completed about 6,300 tests. Our positivity rate currently stands at 4.4%. There are currently active alerts or outbreaks in 231 schools, or about 10% of the schools in the province. Currently, these schools have a combined total of 846 cases since in-person classes resumed. There are currently 326 people in hospital with COVID-19, including 51 in the ICU. Sadly, I must announce that 11 new deaths were reported to Alberta Health in the last 24 hours. My sympathies go to the families and friends of these individuals, as well as anyone who is mourning the loss of a loved one, no matter the cause. Today, I would like to talk once again about stigma and the importance of supporting those who contract COVID-19 or who are exposed to it. We have heard concerns from individuals connected to recent outbreaks that they are feeling criticized, stigmatized, or even blamed. It is important to remember that every part of this province and every sector of society has been touched by this virus. Many of the cases and outbreaks we see have been triggered by a series of unfortunate events. We must be compassionate with those who test positive and those who have been exposed. And we must support those who have even mild symptoms to stay home and away from others without shame. Stigma and blame risk driving cases and spread underground and risk discouraging people from going for testing. We all have a role to play in creating supportive environments to prevent spread. Another critical way to prevent spread of the virus is, of course, immunization. Starting tomorrow, seniors age 75 and older will be able to book their appointment to receive a COVID-19 vaccine. I know that many people are eagerly looking forward to getting the vaccine. I also know there are many questions. So I'd like to talk a little more about how this will work, recognizing we will be updating our website with detailed instructions tomorrow. The first question I know many people have is, do you have to be 75 to be eligible? The answer is you need to be born in 1946 or earlier. So if you're 74 and turning 75 this year, you are eligible for the vaccine. The second question I know many people have is, how do I register for my shot? If you are a senior, 75 or older, living in a licensed supportive living facility, you do not need to book an appointment. AHS is already contacting all those sites directly to arrange for you to receive both your first and second dose at the appropriate time. If you live independently in the community, starting tomorrow morning at 8:00 a.m., you can book an appointment through the online AHS booking tool or by calling HealthLink at 811. AHS will start booking appointments tomorrow, but please be patient. Given the risk of serious outcomes from COVID-19 for these individuals, we expect there will be enormous demand for immunization. We have increased staffing for HealthLink to make sure that any senior who wants an appointment can get an appointment as quickly as possible, but we know this will take weeks to achieve. For many folks, I know it may feel like you have been waiting a very long time for the vaccine and you are keen to get a first dose as soon as possible. I'm asking everyone booking appointments to please be patient, especially in the first few days. For those who try to book after all initial appointments have been filled up, remember that new appointments will be made available as more vaccine arrives. With the doses we are anticipating receiving, all Alberta seniors who want vaccine will be able to get their first dose before the end of March. It may just take a little bit of time to get your appointment, as availability depends on the timing of the supply we receive in the province. Because there will be more demand than supply in the next few months, and we must ensure that no doses are wasted, all immunizations are being done by appointment rather than walk-ins. As you book your shot with AHS, you will be able to select from available appointments at one of 58 sites located across the province. This will enable people to receive the dose as close as possible to their home. Once you have booked your appointment with AHS, you will be provided a confirmation with the location, date, and time for your first and second dose appointment. Each site will be operated by trained professionals with appropriate personal protective equipment, distancing, and other measures in place to limit any risk of exposure. Many people may be wondering what dates and times appointments will be offered. Starting tomorrow, we will be booking appointments for 7 days a week, including on weekends. We only have a limited supply of vaccine right now, so initially appointment times will be available between 8:20 a.m. and 3:40 p.m. As more doses arrive, we will extend those hours. In addition to AHS, in the future we will also offer the vaccine through participating pharmacies. This is similar to how we offer the influenza vaccine every year. Details on this program and how seniors will be able to book an appointment at a participating pharmacy will be announced later this week. I have also heard questions about whether family members will be able to book appointments for their parents or loved ones. The answer is absolutely yes. If you have a family member or friend who is eligible for the vaccine, please consider asking them if they need assistance in booking their dose or getting safely to their appointment. At their appointment, please make sure that seniors have their photo ID and Alberta Healthcare card to confirm their identity and age. When it comes to transportation to vaccine appointments, we are encouraging a community approach. I am asking family and friends of any eligible senior to help out if that individual needs transportation to receive the vaccine. If you are a senior and can't find transportation to your appointment, please call 211 and they will help out. Finally, I want to ask Albertans for patience. More than 230,000 seniors 75 and over will now be eligible for the vaccine, along with all those in Phase 1A who are still receiving their doses. This is a massive expansion for our province and a big step forward. However, unlike our yearly influenza campaigns, we do not have large stockpiles of the vaccines ready to go province-wide. Instead, we are relying on new shipments that we anticipate will be increasing each week. It will take time to immunize all our eligible seniors, and there will likely be a few hiccups along the way as we continue expanding. But healthcare teams across Alberta will be working very hard to make sure that each eligible senior gets immunization as soon as possible. This is a major milestone in our vaccination program and in our fight against COVID-19. By continuing to vaccinate those at greatest risk of severe outcomes, we are protecting thousands of parents, grandparents, aunts, uncles, brothers, sisters, neighbors, friends, and community members who are most vulnerable to this virus. In the next few months, as we immunize these groups, it is more important than ever that we keep being the vaccine for each other. Every day that cases stay steady or decline means that fewer Albertans get sick and need hospital care, and the strain on our health systems ease just a little bit more. The more we can keep spread down, the safer we can keep our loved ones and communities while we work to immunize everyone who is most at risk. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller, please?
First question is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. You said there are 58 vaccination sites across the province. What kind of sites are these, and will AHS use pharmacies and doctors' offices?
The 58 sites are the sites that Alberta Health Services is using for COVID-19, building on the tried and true infrastructure and processes that are used for influenza vaccination clinics. In addition, over the coming weeks and months, we will be working with partners such as pharmacists, and you'll hear more about pharmacists later this week, and physician offices we'll be hearing more about in the coming months with respect to how those partners will be involved in our vaccine rollout. It's important to remember that the vaccines we currently have available are those that require specialized storage, including ultra-frozen storage. And so we need to make sure that as we're expanding to different sites, we're taking into account those storage and handling requirements and working step by step to expand with our goal of offering vaccine to eventually all Albertans who want it across the province as conveniently as possible.
Operator, can you put through the next caller, please?
Next is Bill Kaufman with Post Media. Go ahead, Bill.
Yes, Dr. Hinshaw, thanks for taking my question. I know that your federal counterpart, Dr. Tam, said today that given the efficacy of the vaccine so far, that we could be expecting a elimination of the tougher parts of the lockdown, possibly before the end of the summer. What's your take on that?
With the volumes of doses that we're currently anticipating we would receive, as we've been told by the federal government, I would anticipate that if we have, again, all Albertans who want a vaccine, if we're able to offer all those individuals vaccine by the end of the summer, and if we have enough Albertans who step forward to take the vaccine that we can protect those most at risk, I think that is a possibility, but it really does depend on the next few months. It depends on our ability to keep the spread of the virus low for the next few months while we roll the vaccine out, and make sure that as we get that additional supply over the coming months, we're encouraging Albertans to take us up on the offer of vaccine to protect themselves and their communities.
Operator, can you put through the next question, please?
Next is Jesse Weisner with Global TV. Go ahead, Jesse.
Hi, Dr. Hinshaw. This is kind of a follow-up to the first question there. Are you able to elaborate at all on when doctors will be able to give vaccines? And is there also any concern about seniors being able to make it to one of the 6 vaccine sites with possible transit issues?
So I just want to 58 vaccine sites across the province starting this week, and we will be able to provide more information later this week about pharmacies, which will expand the number of locations in the near future. I don't have a specific date on when doctors' offices will be able to offer vaccine, as we're currently working through those details. Again, one of the challenges is making sure that the specialized storage requirements that these vaccines have, which require specialized infrastructure, that we're able to ensure that all of the handling and the processes for getting vaccine distributed to different sites are in place. And so that's why, again, there's a stepwise approach with 58 Alberta Health Services sites online already this week, expanding in the near future to additional pharmacy sites. And then, as I said, I don't have a specific date, but I would imagine that in the coming months we will be able to expand to physician offices once we ensure that infrastructure and vaccine availability is confirmed to be able to move in that direction.
Operator, can you put through the next caller, please?
Next is Matt Woodman with CTV. Matt Woodman with CTV at Edmonton. Go ahead, Matt.
Hi there, Dr. Hinshaw. The three highest active COVID rates are all in rural areas north of Edmonton, with Smoky Lake sitting with the highest right now. Why do you think that is? How concerning is it? And what is being done to address it? Thank you.
The rates that are increasing in parts of rural Alberta, certainly they're concerning. It's concerning when rates increase in any part of the province. As to what is driving each individual location, it's not clear that there's a single cause. There are certainly different outbreaks happening in different parts of the province where we've seen within a particular group spread from one to many. So again, wanting to reiterate that importance of making sure that all of us are following those COVID precautions every day. And with respect to what is being done about it, as we do with all of our localized spread, we're working very closely with local public health to identify, first of all, if it's a specific outbreak, that all of the outbreak protocols are put in place in that location. If it's more of a community issue, again, working with communities to make sure that community leaders understand the source of the spread and what needs to be done about it. And again, offering that consistent messaging, which is to say that no matter what part of the province an Albertan lives in, there is risk of COVID-19, and we must continue to follow the measures that are in place in order to keep reducing our cases, in order to save our healthcare system and be able to continue moving forward on this path forward while we roll out the vaccine program.
Operator, can you put through the next caller, please?
Next is Lisa McGregor with Global Edmonton. Go ahead, Lisa.
Hi, Dr. Hinshaw. There's some confusion around Step 2 reopening plans, a lack of detail and no advance notice to businesses. I spoke with a large Alberta gym franchise today who says they will stop getting federal subsidies the day that you announce they can reopen in our province, even if it takes them a week to get ready to actually open. So what is the rationale in not giving businesses advance notice, even just a few days before officially reopening in Stage 2, which could all come all at once the same day as early as Monday?
I want to be clear that a decision has not yet been made about reopening, and a decision has not yet been made firmly, again, about the timing of implementation of those changes. So those decisions, and I recognize it's challenging for businesses who are looking for certainty around dates and timelines, but we did need the additional time to be able to look at the full 3 weeks of data following the first step, to be able to understand what's happening with our numbers, what's happening, where is spread happening, and if we need to take longer or a more cautious approach going forward. And so again, recognizing that it is frustrating for businesses, while the decision will be made at the earliest on March 1st, I'm not able to say with certainty exactly when that would be implemented. It could be as early as that same day, or it could be that a decision is made with some lag time for businesses to prepare for opening. And recognizing this is frustrating, unfortunately, this is the current situation.
Operator, could you put through the next caller, please?
Next is Tom Ross with 660 News. Go ahead, Tom.
Hi. Just wondering if you can go into some more details about how you're preparing for the rash of booking appointments that will come tomorrow morning. I'm expecting there's going to be some technical issues on the website. Are you taking any efforts to mitigate that so more people can make an appointment tomorrow?
We've worked with Alberta Health Services and the Vaccine Task Force to test the electronic systems. I mentioned that we have increased staffing. Alberta Health Services has increased staffing with HealthLink. But I will reiterate that while all of that work has been done, there are many people who will be eligible starting 8 o'clock tomorrow morning. So I anticipate that people will need to be patient and keep trying to get into the system, whether it's by phone or by internet. I would say that Alberta Health Services has worked to develop a waiting area. So if the number of people who can book appointments is currently at its maximum, that people may be diverted to a waiting area where they can see the amount of time that they would anticipate waiting before being routed into that booking area. And so, again, multiple layers of the booking process have been put in place to try to give people as much information as possible when they're in that booking process about where they are in line to be able to get into that immunization portal, and then again when they're there able to make the choices about which available appointments they would like to select. So We've done as much as we can to try to prepare. There will always be some challenges as we roll out an immunization program of this size, so I would ask Albertans to continue to be patient, to keep trying, and we will continuously improve and make sure that any issues that are identified, we move into our continuous quality assurance process.
There is only one question left in the queue, so operator, please put through our final caller.
Final question is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hey, Dr. Hinshaw, I understand that decisions are still being made and numbers are still being looked at. Yesterday you said it's difficult to pinpoint exactly what leading indicators you're looking at, but you also said that we're looking at a sort of a plateau rather than a continuous drop in terms of case counts. Again, 260 cases today. If we stay in this 200, 300 range throughout the rest of the week, I guess would that be a positive sign towards moving towards that March 1st entering of step 2?
It's important that we look at all three leading indicators. So looking at our R value, which, as we know, we calculate once a week. And unfortunately, the change over the last 2 weeks, we've seen the R value increase to over 1 when we look across the province, and that is a concern. So we will be looking at those new case counts. We will also be looking at our positivity rate, which has unfortunately increased also in the past several days. So it's a combination of all of those three that we're looking at to determine if we are entering a new growth phase or if this is a plateau and we can potentially move into that step 2 safely next week. So the absolute metric, again, will depend on what those trends, what the context is, where we're seeing the numbers, if we feel that they are localized issues that can be brought under control, or if it's a more generalized growth phase that we're seeing spread across the province. Those are the things we'll be watching for over the coming days to enable that decision to happen potentially on March 1st.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.